If you've been told that type 2 diabetes is a life sentence, I want you to stop and listen to me carefully. You were told it's permanent. You were told the only path forward is more medication, higher doses, and managing side effects until the day you die. But here's what nobody tells you. 3 credible clinical trials, real research. Published in real journals have shown that up to 70% of patients can reverse type 2 diabetes without a single new prescription. And the most shocking part? Most of your own doctors don't even know these studies exist. By the end of this video, you'll know exactly which foods reverse insulin resistance, which daily habit is quietly destroying your pancreas, and the precise eating pattern that has pulled thousands of seniors off medication for good. But first, you need to understand what's really happening inside your body. My name is Dr. Ember. I'm a senior health specialist with 13 years of clinical experience working with patients over 60. In those 13 years, I've watched countless men and women in their 60s, 70s, and even 80s walk into my office terrified that diabetes was the beginning of the end. Today, I'm not going to give you generic advice. I'm going to tell you exactly what I would tell my own mother if she were sitting across from me right now. After 60, your body becomes far less forgiving of the foods you got away with eating for decades. 3 specific changes make this critical. First, your pancreatic beta cells, those are the small cells responsible for producing insulin, slowly become exhausted after years of overwork. Second, your muscle mass declines, and muscle is the main place your body stores excess sugar safely. Less muscle means more sugar floating in your bloodstream. Third, visceral fat, that's the dangerous fat wrapped around your liver and pancreas, accumulates silently, even in people who look thin on the outside. Here's a fact most patients have never heard. Your entire body holds about 1.5 gallons of blood. Normal blood sugar means just 1 teaspoon of sugar dissolved in all of that blood. A diabetic diagnosis means 2 teaspoons. That's it. Just 1 extra teaspoon. But the average modern diet delivers between 50 and 100 teaspoons of sugar every single day once you count the refined grains, cereal, pasta, bread, and packaged foods that convert straight into glucose the moment they hit your stomach. For 10, 20, even 30 years, your body fights back. It pumps out more and more insulin to keep your blood sugar normal. You feel fine. Your labs look fine. And then one day, the system collapses. Your fasting glucose hits 126, and a doctor tells you that you have diabetes. That diagnosis is not the beginning of the problem. It's the end of a 30-year war your body was quietly losing. And here's where it gets interesting. 1, the skinny diabetic lie that catches seniors off guard. Most people believe diabetes only happens to those who are overweight. After 13 years in practice, I can tell you that's flat out wrong. The clinical trials I'm going to walk you through included patient after patient who looked perfectly trim, yet their blood sugar was completely out of control. The reason is something called visceral adiposity. That means hidden fat buried deep around your liver, your pancreas, and your organs. You can't see it in the mirror. You won't catch it on a bathroom scale. But it strangles your insulin response from the inside if you're a thin senior who has been told you don't fit the profile. I want you to take this even more seriously than your heavier friends, because thin diabetics are diagnosed later, treated softer, and damaged longer. 2 to 3 studies Big Pharma hopes you never read. Stay with me here, because this is where the science gets undeniable. The first trial, called the DIRECT study, took ordinary type 2 diabetics and changed nothing but their food. The results? 46% went into full remission. The Montreal study delivered a 40% reversal rate. And the Retune trial, the most stunning of the 3, achieved 70% remission. Remission means your blood sugar normalized and you no longer needed the medication. No surgery, no new drug, just food and timing. These results outperform many pharmaceutical interventions, and the side effect profile is essentially 0. So why hasn't your doctor mentioned them? Because there's no money in prescribing a grocery list. Big Pharma will not fund what they cannot patent. That doesn't mean the research is hidden, it means it's just not promoted. 3 the quiet 30-year slide most patients never see coming. Here's the part that disturbs me every time I explain it to a new patient. Diabetes does not happen overnight. It develops in 4 hidden phases. Phase 1 is adaptation. Your body handles excess sugar by releasing more insulin. Phase 2 is maladaptation. Your cells get tired of the insulin signal and start ignoring it. We call that insulin resistance. Phase 3 is tissue damage. Sugar binds to your proteins through a process called glycation, which stiffens your arteries and slowly poisons every system that depends on flexible blood vessels. Phase 4 is the diagnosis itself. By then, your beta cells are already exhausted and your arteries are already hardening. Modern medicine intervenes at phase 4. By that point, you've been bleeding for 20 years. The fix has to start much earlier, and the good news is that even after diagnosis, the damage can still be reversed. For the 4 tissues diabetes quietly destroys after diagnosis, 4 specific tissues take the brunt of the damage. Your kidneys, which filter your blood, your arteries, which feed your heart and brain, your peripheral nerves, especially in the feet, which is why so many diabetic seniors lose sensation, and your eyes, where diabetic retinopathy slowly steals your central vision. The standard 7 to 10 minute office visit isn't long enough for any doctor to explain this properly. And almost no medical school spends serious time on lifestyle reversal. They're trained to manage the disease, not undo it. That's where you, the patient, have to take the lead. Quick question while you're with me. How old are you and how long ago were you diagnosed? Tell me in the comments. I read every one. Because the next thing I'm going to tell you might be the most important habit to break after 60. 5, the snacking habit that spikes sugar more than sugar itself. Most people focus only on what they eat. After 13 years of watching blood sugar patterns, I can tell you that when you eat is just as important. Every single time you put food in your mouth, even a small handful of nuts or a piece of fruit, your pancreas fires off another wave of insulin. Your body was never designed to be fed every 2 hours. Constant snacking keeps insulin levels chronically elevated, and chronically elevated insulin is what drives the receptor resistance in the first place. So even a healthy snack eaten too often can be enough to prevent your blood sugar from ever truly normalizing. The solution isn't just better food, it's longer gaps between meals. 6, the 2 meal pattern that resets insulin sensitivity. Here's where the strategy becomes simple. Combine a low carbohydrate diet with intermittent fasting, meaning 2 meals a day, no snacks. In the morning, coffee with cream is fine. No sugar, no sweeteners. If you're truly hungry, eat breakfast, but most patients find their hunger fades within a week. Then have your first real meal at lunch animal protein like meat, fish, or eggs paired with vegetables. Add nuts, seeds, cheese, yogurt, or kefir if you want. Your second meal looks just like the first. The goal is to keep total daily carbohydrates under 50 grams, ideally under 30, and no snacks in between. Hang a little sign on your fridge that simply says kitchen closed. It sounds silly. It works. 7, the foods that quietly sabotage every senior's blood sugar. Here's where it gets uncomfortable, because the list is longer than most people expect. Sugar in all its forms, refined starches like white bread, pasta, and cereal, most fruit, with the exception of about 1 cup of berries per day, beans, fruit juice, grains of every kind, and seed oils, corn oil, canola oil, soybean oil, and the maltodextrin hidden in countless packaged products. These foods don't just spike your sugar, they keep insulin elevated for hours after you eat them. Eliminating them from your pantry is not optional, because the next time you're tired, stressed, or anxious at 9 p.m., whatever is in your cabinet is what your hand will reach for. Don't fight willpower. Remove the temptation. Let me tell you about Margaret. She was 68, a retired school teacher, and she came into my office holding a folder of lab results that she had been carrying for years. Her fasting blood sugar was 152. Her A1C was over 8. She had been on metformin for 9 years, and her doctor had just added a second medication. She told me very quietly that her own mother had died from diabetic complications, and she had started planning her funeral. Margaret wasn't overweight. She walked her neighbor's dog twice a day. She ate what most Americans would call a healthy diet: whole grain toast in the morning, fruit smoothies at lunch, pasta at dinner, a glass of wine, and a little dark chocolate before bed. On paper, nothing looked dramatic, but every single one of those choices was quietly feeding the disease. We sat down together and I walked her through the exact same plan I just walked you through. 2 meals a day, animal protein, vegetables, healthy fats, berries in small amounts, no snacks, a 10-minute walk after each meal, magnesium at night. The first 2 weeks were difficult. She called me on day 6 and admitted she had cried in the cereal aisle. But by week 3, her cravings were gone. By week 8, her fasting glucose was 108. By month 4, she was working with her primary care doctor to slowly come off both medications. At 6 months, her A1C was 5.6, officially out of the diabetic range. When she came back to see me, she sat down and said, "Dr. Ember, I spent 10 years thinking my body was broken. It wasn't broken. It was just hungry for the right food and tired from never being allowed to rest." That moment stayed with me. Here is exactly what to do after watching this video. 1, bring these 3 studies to your next doctor's appointment: the DIRECT trial, the Montreal study, and the RETUNE trial. Ask your physician to review your medication plan with the goal of slowly weaning down as your numbers improve. Never stop a medication on your own. 2, stop eating breakfast for the next 7 days unless you are genuinely hungry. Allow your body the rest it has been begging for. Coffee with cream is fine. No sugar, no sweeteners. 3, build every meal around animal protein, non-starchy vegetables, and healthy fats. Meat, fish, eggs, cheese, yogurt, kefir, leafy greens, avocado, olive oil, butter. Keep total carbohydrates below 50 grams a day and aim for 30 if you can. 4, eliminate the 7 categories: refined sugar, starch, most fruit, beans, juice, grains, and seed oils. Walk through your pantry this weekend and remove every product on that list. If it's not in the house, you won't eat it at 10 p.m. 5, take a 10-minute walk after lunch and after dinner. This single habit pulls glucose out of your bloodstream into your working muscles, which dramatically reduces post-meal sugar spikes. 6, replace your electrolytes. As your body releases stored water, and many patients lose 7 to 10 pounds of water weight in the first week, you'll also lose potassium, magnesium, and sodium. Add a high-quality magnesium glycinate at night, a potassium-based electrolyte powder during the day, and don't restrict sea salts. If you feel weak or cramp easily, add more, not less. 7, track your fasting glucose every morning with a basic fingerstick meter. Watching the numbers fall week over week will keep you motivated longer than willpower ever could. And bring those numbers to every doctor's visit so your medication plan can be adjusted safely. These 7 steps are not a quick fix. They are the same exact protocol that delivered 46%, 40%, and 70% remission rates in real clinical trials. They will work if you work them. I want you to hear me clearly. The story you've been told about type 2 diabetes, that it's permanent, that it only gets worse, that medication is your only option, that story was wrong. Not because your doctors are bad people, but because the system they trained in is built around managing disease, not reversing it. You are not broken. Your body is not failing you. Your body has been doing the best it can with the fuel it has been given for decades without complaint. Give it the right food, give it rest between meals, Give it a chance to heal, and it will do exactly what it was designed to do. I've watched patients in their 70s and 80s come off insulin. I've watched seniors who were told they would lose their feet, keep them. I've watched women like Margaret rewrite the ending of a story they thought was already written. Your age is not a weakness. Your knowledge is your power. And the moment you take that power back is the moment everything begins to change. If my own mother were sitting here today, this is exactly what I would tell her. I'm telling you the same thing now because somebody needs to. Everything I've shared today is general health information based on 13 years of clinical experience and published medical research. Every person's situation is unique. Before making any change to your medication, your diet, or your treatment plan, please consult your own doctor. If this video helped you or helped someone you love, please share it. That one share might save a life. Subscribe to Dr. Ember for more honest senior health insights you won't hear in a 10-minute office visit. Take care of yourselves. Stay informed. I'll see you in the next one.